Dr. Ghassan Abu-Sittah is the co-director of the Department of Plastic and Reconstructive Surgery at the American University in Beirut. He has worked as a war surgeon in Iraq, Syria, southern Lebanon, and during the 3 wars in the Gaza Strip. He's also published extensively on war injuries, including a medical textbook, Reconstructing, the war-injured patient. Dr. Abu-Sittah, thank you for joining us on the program. Just picking up on how the coronavirus pandemic is being handled in Brazil and all around the world, of course. How much more difficult has COVID-19 made your work?
It has become extremely difficult, especially in attempting to respond to emergencies. Most countries have imposed either travel restrictions or quarantine on arrival, even for humanitarian workers who are trying to respond to an emergency in a country. They are either kept in quarantine in transit or they're kept in quarantine on arrival. And that really has made it very difficult to respond to emergency. For example, when the large explosion happened in Beirut, a lot of the medical teams had to wait until their PCR tests came back before they could be deployed.
Can you tell us about your work in Beirut? I understand you were there until very recently. What's been happening in terms of your profession and the work that needs to be done with the victims?
So, tragically, Lebanon has lived through these kinds of injuries in the past during its multiple wars, its civil war, and as a result of the overflow of the Syrian civil war. What is different is that this is a single event that led to the injuring of 6,000 people within 15 seconds. We all saw the huge concussion wave that was produced. And what that did is basically created explosions inside people's living rooms and bedrooms as glass shattered and flew towards its victims, as doors were blown off their hinges and were thrown against people, and people themselves were thrown against the wall. And so suddenly, the hospital that I was working in, which is the American University of Beirut Medical Center, we had 450 injured arrive within, I would say, half an hour, as people stumbled out of their houses and out of their offices and shops and made their way. And by and large, it was all shrapnel into the faces, into the body, into the arms of people as they tried to shield themselves. And it involved all groups, all age groups. I, on the night of the explosion, operated on a 20-day-old baby that had a severe facial laceration from glass. We had the elderly, and we had all of the age groups in the middle.
When I look at the list of the countries and the war zones you've worked in, I can't think of many more difficult situations in which to practice any profession. What is the most difficult thing about your work in these zones? I don't suppose it's actually the physical medical work that you're trained to do. Would it possibly be actually dealing with the patient as a human being? Because the medical stuff you do must be trained within you, but dealing with humans is a different situation with every different individual, I suppose.
Absolutely. I mean, the aim of war, unfortunately, and an aim of all weapons, is to violate the human body. But what it also violates is a life, and with that life comes a social structure and a community and loved ones and families. And it is seeing how that single event shatters and creates a ripple that goes beyond the patient into their whole family and their whole community. And it's that aspect that is still very difficult. The other aspect of it is that we fool ourselves when we think that wars are a temporal event, that they start on a day and they finish on another day. I've yet to be in a conflict that was like the battles that we studied at school, that they start on a single Sunday and they finish on a Friday afternoon, a few months later or a few years later. All of these conflicts, when you decide that you need to leave, are still running. or that they have become somehow like an endemic disease in these countries, where the injury happens over and over. You know, the siege in Gaza, the wars in Gaza. Gaza has not had a single day without some kind of warfare since the 1948 war that created the refugee crisis. And then you had the different wars in Gaza, and then the intifadas, and then the wars and the siege. Similar place like Lebanon, which had 17 years of civil war, an Israeli invasion in '82, a war in 2006, and then the Syrian war. And so that lack of temporality is the most difficult thing when you almost create a biosphere in which people live. On a personal level, for me, the turning point in my life was always when I had children of my own. That was the most difficult thing. And I could notice how my ability to deal with injured children changed after that.
Dr. Ghassan Abu-Sittah, thank you so much indeed for your time. You know, I had so many more questions to you, but time is always short on programs like this. And thank you so much for the work that you're doing on World Humanitarian Day. We salute you.